Live Well by Faith is a public health initiative here in Columbia, Boone County. We're addressing health disparities in the African American community here, specifically hypertension and diabetes, which are critical in this county, but we are making a difference. We set up health ministries in the African American churches that are willing to participate. And we've been doing this work for 3 years, and I noticed that not one of the African American churches had a defibrillator. Friendship, St. Luke, Second Baptist, Russell Chapel, 5th Street. It is amazing. 6 churches are going to leave here tonight with that life-saving equipment ready to install in their facilities.
Don't touch patient. Analyzing. No shock advised. Start CPR.
I hope that you never have to use the device. That's
Right.
what our hope is, right? Is that we never want this to happen. But most people will say when they have an AED that their plan is to call 911, right? That's what everybody agrees that that's what you do. But with whether it's a heart attack or sudden cardiac arrest, we have to do more than just call 911.
EMT explained to me that it's just seconds. Seconds make a difference before the ambulance, after you've called 911, those seconds are crucial. If you can administrate CPR and maybe the life-saving AED shock, if it's your loved one, you would want everything done right now. You would not want to have to wait for medical attention to arrive.
So we have what we call real CPR feedback. And how great that is let's just say, who do you love more than anybody in this world? And that person goes down and has cardiac arrest. Do you want them to guess if they're doing CPR properly, or do you want them to know? The entire time, it's guiding you and prompting you. If you're doing good compressions, the AED will reward you and say, good compressions. And if you're not pressing hard enough, the AED will tell you to press harder.
Having a defibrillator really means a lot because you never know when there's going to be an emergency. It could be anybody. Some people think that you're going to use the defibrillator for somebody that's either elderly or they've had a heart condition in the past, but that's not necessarily true. It could be anybody. So it's good to have it and to know how to use it.